Good afternoon, everyone. Thank you for joining us for our presentation specifically for healthcare providers who are authorized to treat workers' compensation patients, where today we will be sharing the latest updates on several initiatives that are helping to make the board better for healthcare providers and the workers' compensation system overall. I'm Adam Rossi from the Communication and Outreach Unit here at the board. Joining me today, we have Dr. James Tachi, the board's medical director. Also on hand are Paula Rauch, Christopher Failing, and Eileen Moss from our medical director's office, and Dan Giovanangelo from our Office of Regulatory Affairs will also be joining us as well. They will answer any questions you have today. We do ask that you enter any questions you have in the chat box. Again, if you look on the bottom right-hand side of your screen, there's a little chat box, a little chat bubble. You can click on that and a chat box will pop up. You can enter your questions through there to all panelists, and you may enter your questions at any point during today's presentation. However, we will be holding off until the end of the presentation to take a look at the questions and answer them. We will answer as many questions as we can, but if you have questions that we either don't get to today, or if you think of something after the session ends, we will also be providing you with resources at the end of today's presentation. We will also be providing you with a copy of today's presentation along with a recorded version. They will be on our website as well as our YouTube page, and you will be notified via email when those are available. If you are not signed up for email notifications, we will also be going over how to sign up for those as well. So with that, we will go ahead and get started. And again, I do want to welcome you to our webinar on what authorized providers need to know, a session we do schedule regularly to keep authorized healthcare providers apprised of any significant news, regulations, process and system changes, or any other relevant updates you should be aware of. Before we get in today's presentation, we would like to thank you for choosing to treat injured workers in the New York State workers' compensation system. Having more treating providers means New York's injured workers have more options and better access to high-quality health care. As you may be aware, the board has been working towards making the workers' compensation system better for injured workers, better for businesses, and better for healthcare providers through several modernization efforts that improve stakeholder interactions within our systems. Over the past few years, we've undertaken several initiatives to improve healthcare and enhance the experience of treating providers. We continue efforts to make it easier than ever for board-authorized providers to be part of the workers' compensation system. We truly are working to take the comp out of complicated, and we will continue to share progress with you and ask for your feedback and input as we move forward. During today's session, we are going to start by sharing some exciting hot off the press news on telehealth. Following that, we will briefly go over the board's medical portal, which providers use to access important tools and information. We'll then review OnBoard, the board's business information system, and then we'll touch base on the New York Medical Treatment Guidelines, also known as the MTGs, and the training that is and will soon be available. We will briefly update you on the board's transition to the Universal Billing Form, the CMS 1500, which took effect just over 1 year ago. We will also remind you some things regarding workers' compensation and COVID-19, and then share some helpful resources that are available to you on all of these and other topics. Finally, like I said, we will leave time at the end of the presentation to answer any questions you have. But first, we do have some big news. As of yesterday, July 11th, telehealth is now a permanent part of the New York State workers' compensation system, following the adoption of a regulation that was many months in the making, with several iterations and rounds of public comments. We're very happy to now have this in place, and I will now briefly share how we got here and what it means. In New York State, telemedicine was an option before COVID-19, but it was limited to phone calls to discuss test results in lieu of an in-person visit, and within a finite time window. During the pandemic, emergency telehealth regulations significantly increased the permissible uses of telehealth on a temporary basis to ensure continuity and access to care. Emergency regulations were extended multiple times. A 2021 study by the Workers' Compensation Research Institute found that telemedicine is changing the way healthcare is delivered on a national level. As of the first quarter of 2021, use of telemedicine for evaluation and management services was still higher than prior to the pandemic. However, post-pandemic, physical medicine visits have returned to near pre-pandemic levels. Costs for services that were delivered both via telemedicine and in person were generally similar. The number of visits per patient when telemedicine was present, relative to only in-person care, was larger when follow-up visits were a mix of telemedicine and in-person services, and smaller when all follow-up visits were delivered exclusively via telemedicine. The board's permanent telehealth regulations have gone through several iterations with extensive stakeholder input, and the new permanent telehealth regulations took place effective yesterday, July 11th of 2023, following the expiration of the last set of emergency regulations. Now, let's dive in on some of the details surrounding this new permanent telehealth regulation. The newly enacted New York State regulation states that telehealth appointments may be performed by physicians, podiatrists, psychologists, nurse practitioners, physician assistants, and licensed clinical social workers through two-way audio and visual or audio-only communications. The provider must also be available for an in-person visit within a reasonable travel time if necessary. An in-person visit may be required, as may be specified in the MTGs, or based on the clinical age or stage of the condition as follows. For MDs, DOs, DPMs, NPs, and PAs, for the initial visit, every third visit, whether acute or subacute, every 3 months if chronic but not at MMI, and annually if chronic and at MMI. For psychologists and licensed clinical social workers, telehealth should be permitted for the first and subsequent visits, including group therapy, irrespective of clinical stage of the condition. Remote behavioral health visits should be limited to situations where there is no benefit to in-person services versus remote services, or when an in-person office visit poses an undue risk or hardship on the patient. The reason for the use of a remote telehealth visit should be documented with each use of a telehealth visit. Treatment may not be rendered via telehealth for chiropractors, acupuncturists, physical therapists, or occupational therapists. Telehealth appointments that have been scheduled prior to the effective date of these new permanent regulations do not need to be changed to an in-person visit in order to conform to this regulation, and the use of telehealth should not be the sole basis for challenging the results of these visits. However, any appointments scheduled after July 11th of 2023 must now conform with this regulation. The regulations also delineate various clinical scenarios that indicate an in-person exam may not be necessary, such as a routine follow-up appointment after a comprehensive initial in-person exam has already been conducted, or to discuss test results and/or counsel on clinical options, and when an in-person exam is necessary, such as to perform procedures, emergencies, eye conditions, nuanced or complex issues, etc., or when an in-person physical exam might reasonably impact the accuracy, quality, or certainty of the assessment, treatment, or recommendations. Some scenarios do require an in-person visit. They include, but are not necessarily limited to, urine drug testing, appointments to determine permanency, impairment, or disability, initiation of a chronic medication, or if the patient lacks the technology, capacity, or the desire for telehealth visits. We are frequently asked whether independent medical exams, known as IMEs, can be performed via telehealth. It should first be noted that technically IMEs are not considered treatment. With respect to performing IMEs remotely or virtually, this is permissible if all of the parties agree, and as long as the IME is not being performed to determine permanency or permanent impairment. And as I mentioned, these regulations went through several iterations incorporating extensive stakeholder input, and we do believe that the newly enacted regulation strikes an excellent balance of that input. New telehealth regulations are just one way the board is helping to make the board better for providers. Many of you may be familiar with the board's medical portal, but for those of you who are not, we do have some pertinent information to share about this crucial tool. The medical portal offers convenient access to trainings, the MTG Lookup Tool, the Drug Formulary Lookup Tool, and OnBoard all in one place. The portal also has a link to the XML agreement, which providers need to accept prior to sending CMS 1500 forms electronically through a clearinghouse. While most, if not everyone on this webinar should have access already, I will briefly cover how to get access for anyone who does not have it. In order to access the medical portal, you will need to request a board-assigned ny.gov user ID and password. This is not the personal ny.gov ID that you may have with other agencies, such as DMV or Department of Tax and Finance. The ny.gov user ID and temporary password will be generated for you when you submit a request for medical portal access. You can request access on the board's website at wcb.ny.gov. Go to the Providers page and select Medical Portal under the Quick Link section. When requesting access to the portal, you are required to provide the following information: your healthcare provider NBI, NPI, or if you're a nurse practitioner, you must request access using your RN license. Also, your email address. This should be your individual work email address, not a group or practice email address. The following types of healthcare providers may request access: acupuncturists, chiropractors, licensed clinical social workers, physicians, physician assistants, nurse practitioners, podiatrists, psychologists, physical therapists, occupational therapists, dentists, audiologists, optometrists, and DME suppliers and labs. If you are a healthcare provider and your specialty is not one of those listed, and you need access to OnBoard to submit requests for decision on unpaid medical bills or Form HP 1.0s, you will need to request access as a medical supplier. We also want to note that while all of the reference provider types and entities may access the medical portal, they do not all have the same privileges within the OnBoard system, which we will discuss a little later on. Once you're in the medical portal, what you can do there depends on your provider type. For example, dentists, audiologists, and optometrists cannot be authorized or submit certain forms via the web. We do have a chart that details who can do what, which is available on the Healthcare Provider Overview page if you go to wcb.ny.gov/medical portal, all one word. It is important to keep your information up to date with the board. The board does not distinguish between never authorized providers and those who lapse in authorization. Healthcare providers must renew authorization every 2 or 3 years, which is typically at the same time you renew your registration with the New York State Education Department. However, this is a separate and distinct process, and sometimes things can change during that time period, such as your address, your phone number, your email. So to update your information, you can just log into the medical portal. Under the Medical Provider section, select either New Provider Authorization Request, Authorization Renewal, or Update Authorization Information. Once you have registered for the medical portal, you unlock access to the board's many interactive tools, such as OnBoard, which we will discuss now. As mentioned earlier, the board is working towards making it easier than ever for board-authorized providers to be a part of the workers' compensation system. That's why we are so pleased that the first phase of our new business information system OnBoard one of the largest modernization efforts at the board to date, has been fully live for just about over 1 year now. So today, healthcare providers and insurers are using OnBoard to request and review prior authorization requests for medication, durable medical equipment, and treatment and testing. And we have hundreds of these PARs successfully flowing through the system each day. To date, more than 50,000 healthcare providers have registered for OnBoard, and nearly 36,000 delegates have been added. Since OnBoard launched on March 7th of 2022, nearly 990,000 PARs have been filed online, so one of you on this call could be the lucky 1 millionth person to file a PAR. Something to strive for. Approximately 95% of these are resolved within 1 to 30 days at the level 1 or level 2 stages of review, meaning without escalation. Over the course of the year, the board has made more than 20 system enhancements in direct response to feedback from healthcare providers and other users. If you haven't already done so, we strongly encourage you to sign up for OnBoard as soon as possible. Healthcare providers must use the medical portal to access OnBoard or to renew an authorization, which requires an ny.gov user ID and password for access. The updated medical portal section of the board's website contains full details and information you need regarding how to register and get a New York.gov user ID and password to access OnBoard and to grant access to others to act as your delegate. Visit the provider section of the board's website at wcb.ny.gov/onboard for a guide on registration. So how has OnBoard made workers' comp better for providers? There are several benefits. OnBoard provides increased accuracy, paperless transactions, and a user-friendly interface for interacting with insurers and the board. Healthcare providers can now request board action on unpaid medical bills through submission of a request for decision on unpaid medical bills, which is known as Form HP 1.0, to ensure accuracy and timely receipt. Electronic submissions of PARs for treatment, medication, and DME, PARs for complicated and or invasive medical procedures such as special services may also be submitted. OnBoard also eliminates the confusion on which forms to use, and all submissions are automatically routed to the correct party with a time and date stamp, so we have no more wrong fax number scenarios. We also want to note that the new DME fee schedule became effective with the launch of OnBoard Limited Release. Within OnBoard, authorized providers have the ability to assign delegates to help you work within the system. Assigning delegates, such as your office support staff, can assist you by drafting PARs, which must be reviewed and submitted by the healthcare provider. Monitoring provider OBLR dashboards for insurer responses to PARs. Drafting escalations to level 2 medication PARs, which again must be reviewed and submitted by the healthcare provider. Drafting and submitting PAR escalations to level 3 for medical director's office review. Responding to insurer requests for information. Drafting and submitting Form HP 1.0s. And we do also want to note that the board is seeking to expand the capabilities of delegates. Please note, this is very important, the board strongly advises against a pharmacy employee, DME vendor, or a medical supplier serving as a delegate of the provider or prescriber to prepare PARs. We believe that for most workers' comp prescriptions, the prescription writing is outside the scope of practice of a pharmacy or medical supplier or vendor. Moreover, even if it were within the said scope of the practice, we fail to see how the pharmacist or the supplier or vendor would have enough direct knowledge and understanding of the patient's clinical history and status, or direct access to the provider or prescriber, to appropriately recommend and or provide medical justification of a PAR. Finally, we believe that such a relationship runs a very real risk of the pharmacy or supplier or vendor and the provider prescriber running afoul of state and federal anti-kickback laws. You can visit the link on the slide there to view a registration guide for healthcare providers. We would also like to note that delegates cannot do the following. They cannot accept the XML submission partner agreement, register with the medical portal, or report on a provider's status. This chart on your screen outlines what types of submissions certain provider types can make in OnBoard. So, for example, all provider types listed can submit Form HP 1.0, non-MTG under or equal to $1,000 PARs, and non-MTG over $1,000 PARs. But obviously, not all provider types can submit medication PARs. You can view this chart on the provider overview page at wcb.ny.gov/onboard. Once your PAR is submitted, the insurer has a set number of days to respond. Response requirements vary for certain PAR types. Responses for MTG confirmation are required within 8 business days. MTG variants and MTG special services responses are required within 15 calendar days, but the response time is extended to 30 days if an IME is requested. Non-MTG over $1,000 responses are required within 30 calendar days. Non-MTG under or equal to $1,000 responses are required within 8 business days, and medication and durable medical equipment responses are due within 4 calendar days. Of note, for medication and behavioral health PARs requiring Level 3 review by the medical director's office, the overwhelming majority are resolved within 1 to 2 business days, and all are resolved within 3 business days. Please note there is some variation on response times with weekends and holidays. Visit the board's website at wcb.ny.gov/onboard/providers to see the PAR review section in the Overview tab. You can also view this chart on that page as well. We are often asked how providers can expedite the PAR process. Here are a few helpful tips to receive timely responses to your PARs. Please submit the correct PAR type. Submit supporting documentation, which includes any relevant diagnostic imaging and/or testing reports with the original PAR submission, and do not merely refer to the medical record. Use the MTG Lookup Tool, which is also located in the medical portal. Or you can search, cut, or paste your MTG reference for the requested clinical intervention and include a copy of the result with your PAR. Check or have your delegate check the OBLR dashboard regularly for insurer responses and request Level 2 and Level 3 reviews in a timely manner. Also, respond timely with additional information when a carrier initiates a request for further information in the system. Include a clear clinical rationale for the requests in the medical narrative section, clearly stating why a variance from the MTGs might be necessary. When escalating a PAR to a Level 3 MDO review, include a rebuttal that addresses the insurer's Level 2 denial rationale in the escalation reason field, rather than simply copying and pasting previously provided clinical. Use appropriate MTG reference codes and only use none when the MTGs do not address the specific treatment being requested. Lastly, include the frequency and duration, if applicable, for the proposed treatment in the medical necessity field, and if the request is for post-operative therapy, please include the date of surgery. In May of 2022, the board updated all existing New York medical treatment guidelines, and new MTGs were also added. For any newly authorized providers with us today, here's some quick background on the MTGs. In December of 2010, the board implemented legislatively mandated MTGs that fundamentally changed the delivery of healthcare to injured workers. The MTGs initially included 4 evidence-based guidelines for the treatment of injuries involving the neck, back, shoulder, and knee. These became the mandatory standard of care for dates of service on or after December 1st of 2010. In March 1st of 2013, the carpal tunnel syndrome MTG and updated versions of the then existing MTGs, including a new maintenance care program, were adopted. The non-acute pain MTG, as well as updated versions of the existing MTGs, were implemented for dates of treatment on or after December 15th of 2014. The MTGs effective for treatment as of May 2nd, 2022 are listed here. Please visit the Medical Treatment Guidelines section on the provider page of the board's website for more details. You can access full details on these new and updated MTGs, including a fully searchable and cut and pastable PDF of the respective MTGs on the board's website. Just select Providers on the top of the homepage, scroll down to Resources, and select Medical Treatment Guidelines under the Treatment section. You will also find links to MTG trainings currently available for medical and non-medical professionals. The MTG training that's currently posted are currently only read-only versions that do not come with CME credits. However, we are in the last stages of finalizing our MTG training for CME credits, which will be made available on our website imminently. To access the trainings, just visit the board's website and navigate to the healthcare provider section in the middle of the homepage. Select the Medical Treatment Guidelines link. From there, select the training link on the right side of the page. And just a reminder about the availability of the MTG Lookup Tool in the medical portal. The MTG Lookup Tool allows users to quickly determine whether a particular condition or treatment or test combination is recommended, not recommended, or conditional according to the MTGs. Please note this does not constitute a prior authorization, but it can be submitted as part of the PAR process. When a treatment or test name is selected, the relevant section of the full MTGs for that condition will display. This online tool will help speed treatment decisions and ultimately provide more effective and efficient care for injured workers. The MTG Lookup Tool also has a feature for use by providers that produces a verification summary document in PDF form that confirms a lookup was completed, provides treatment recommendations for that condition, and displays patient-specific case information. This document can be kept by the healthcare provider or attached to any request for services, for example, a PAR, or a medical bill being sent to an insurer as verification that the treatment adheres to the recommendations set forth in the MTGs. The MTG Lookup Tool is available for all MTGs. To access the medical portal and the Lookup Tool, visit the board's website and select Medical Portal from the Online Services menu at the top of the homepage. As the board continues modernizing and improving stakeholder interaction with our systems, we look back on our official transition to the CMS 1500 form, the Universal Medical Billing form from 1 year ago. Since July 1st of 2022, the board has received more than 6 million CMS 1500 forms, including 1.4 million electronic submissions through an XML submission partner. More than 10,000 providers have submitted CMS 1500 forms electronically through an XML submission partner. The board transitioned to the universal form to reduce the administrative burden on participating providers who previously had to use separate board-specific forms for their workers' comp patients. Since July 1st of 2022, healthcare providers have been required to use the CMS 1500 for all workers' comp medical billing. Electronic submission through an XML submission partner is strongly encouraged, although not currently required. As part of the initiative, use of the prior medical or billing reports, including the doctor's initial report, Form C4, and the doctor's progress report, Form C4.2, have been discontinued. Providers must also prominently report the injured worker's temporary impairment percentage, work status, and causal relationship of the injury at the top of the CMS 1500 form medical narrative. Please note that provider types who are not permitted to opine on causal relationship or level of impairment are not required to submit this information. The medical portal provides access to all the online services the board offers, including electronic submission of medical bills to insurers and the board. Once you have accepted the terms of XML submission agreement, you can then discuss details of submission with an approved XML submission partner, which is also known as a clearinghouse. After logging into the medical portal, providers who have not already signed up for XML submission of the CMS 1500 will see a link for Agreement for XML Submission of CMS 1500 under the Billing section. You can select that link and then select the I accept button. The provider's name will be added to the listing of providers authorized to submit XML data, which is updated daily. Once accepted, the link will no longer appear when you sign in again. We'd now like to take a minute to highlight the many benefits of electronic submission. When providers submit CMS 1500 forms electronically, the XML submission partner will submit to the insurer and the board. Providers will have confirmation within 7 days that their bill was accepted or rejected by the insurer. Providers typically get paid quicker. With acknowledgement of receipt from the insurer, the provider is aware that they should not resubmit the bill, and technical errors are identified quickly, so they may be corrected and resubmitted instead of waiting for the insurer to deny the bill. For more information, you can visit wcb.ny.gov/CMS-1500, or you can email cms1500@wcb.ny.gov. When the medical narrative template is used, providers must attach a narrative report with clinic visit history examination findings, including the history of the injury or illness, any objective findings based on the clinical evaluation, the diagnosis and assessment of the patient, and the plan of care. Just noting here that this is really no different than the minimum standard of care requirements for documentation of any clinical encounter, whether it be workers' comp or non-workers' comp. The board has developed a medical narrative report template that can be used to create the medical narrative report that accompanies most provider submissions of the CMS 1500 form. The template includes the 3 elements to include with narratives: patient's work status, causal relationship of the injury or illness to the patient's work activities, and the temporary impairment percentage. It is imperative for providers who are expected to do so to include these 3 elements to ensure workers receive the treatment and indemnity benefits they are entitled to, and for prompt payment to the provider. A medical narrative report may be found legally defective if these elements are missing. However, insurers should not use this as the sole basis for non-payment, especially, for example, if an injured worker with a long-term condition is not working, is at MMI, and has an unchanged level of impairment, and the provider simply documents clinical, occupational, and functional status unchanged from last visit. It is important to note that certain provider types are not permitted and therefore not required to provide impairment percentages or opinions on causal relationship. A PDF of this report can be found at wcb.ny.gov/CMS-1500/requirements under the Medical Narrative Requirements section. For certain types of medical services or supplies, a medical narrative is not applicable. Instead, an attachment is required. For example, a radiologist should submit the radiological report with the CMS 1500, and a DME supplier should submit the physician order with their bill. A full list of attachment examples may also be found in the requirements section of the website. Finally, we want to make you aware of the resources we have been sharing with injured workers who believe they may have contracted COVID-19 in the workplace. While certainly the incidence of new COVID-19 cases are now on the decline, there continue to be COVID-19 claims coming through, and the information is still important to share. The board strongly encourages workers to file a claim if they believe they contracted COVID-19 at work. However, the insurance carrier must notify the board of the incident. Workers have 2 years from the onset of illness to file a claim, and a positive PCR test is required. The board has been holding free informational webinars to the public on this topic. We were doing them monthly, but have since scaled back to hosting them about every quarter. We did actually just host one earlier this week. You can visit wcb.ny.gov/webinars to review a previously recorded session. You can also see when we will be holding our next webinar. As we continue to work on implementing improvements for healthcare providers, we're committed to increased communication with providers, such as this webinar, and targeted emails. The board has also created a special web page dedicated to sharing timely updates on various board initiatives with healthcare provider focus. Visit the board's website at wcb.ny.gov and select the Provider Updates quick link on the provider page. We're also committed to regular engagement regarding OnBoard. As primary users of the new system, your input and engagement in the project is very important. Speaking of OnBoard, for more information, you can visit wcb.ny.gov/onboard. Resources include a walkthrough of the registration process, video tutorials, and recorded presentations for providers. For more information on the CMS 1500 form, including a list of XML submission partners and discontinued forms, please visit wcb.ny.gov/CMS-1500. We also have a dedicated mailbox to answer all questions on the CMS 1500 initiative. That email address is cms1500@wcb.ny.gov. Just want to point out that the email address does not have the dash in the between, as you'll see there on your screen. If you have provider-specific questions, you can call our helpline at 800-781-2362, or you can email mdo@wcb.ny.gov. You can also find the latest provider updates on the board's website. Visit wcb.ny.gov and select the Provider Updates quick link on the provider page. You can stay informed by subscribing to get board notifications straight to your inbox. If you visit our website at wcb.ny.gov, then you can select the Get WCB Notifications on the bottom of the homepage. You get to choose the topics you'd like to subscribe to. You can also follow the board on Twitter, Facebook, Instagram, and YouTube for board news, project updates, trainings, and more. I want to specifically point out that YouTube link right there. If you go to youtube.com/NYSWCB, you'll see a number of previously recorded presentations on such as previously webinars we've done with this, the Providers Need to Know sessions, as well as some other important information you might want to know as providers. So I strongly encourage you to check out the YouTube page. And again, this presentation will also be put up on there as well. So thank you for attending this presentation. As I mentioned, we're now going to take the rest of your time to answer any questions. Please feel free to enter any questions you might have in the chat box. Again, there's a little chat icon on the bottom of your screen. Just click on that and the box will pop right up. I'm going to leave our contact information on the screen for you in case you want to jot that down. And I do see we have a few questions that have already come in. So I'm going to now turn it over to our subject matter experts at the medical director's office. Please give them a couple minutes to review the questions that have come in, and they will be back with you shortly with some answers. Thank you.
Thanks, Adam, for doing a great job on the presentation as usual. This is Dr. Tachi from the MDO. We do have a few questions that have been submitted in the chat. I will take the first couple of questions and then I will hand the mic off to Paula Rausch from our MDO team. The first question states, as a provider, can you object to an NOD or notice of decision, or does the hired worker's attorney have to object on our behalf? The answer is, and this is not a new rule, this has always been the case, treating providers are not parties to the claim. So treating providers are not able to individually or independently file objections to notices of decision or notices of resolution. The injured worker or the patient is able to file the objection, or they may have it filed by they can do it independently, or they may have their legal representative do it on their behalf. There's a second, more nuanced question related to the new telemedicine regs. It states, quote, will a waiver for the, quote, reasonable distance, close quote, requirements be considered for remote and rural areas with insufficient workers' comp providers, but emergency facilities can be identified, or will reasonable distance be further defined? I think it's worth making a clarification with respect to the reasonable distance requirement and the telehealth regs. The reasonable distance requirement really is not designed to operate, operate functionally on a visit-by-visit basis between a provider and the patient. The reasonable distance requirement really is meant to address whether or not that provider should initially be engaging in telehealth with that patient whatsoever. And historically, that has been defined not by waivers or anything like that, but it's actually been defined at hearing, by the workers' comp law judges. So by way of example, if an injured worker is located on the southern tip of Manhattan or on the far eastern part of Long Island, their telehealth visit should not be with a provider who's in the western suburbs of Buffalo, right? Because presumably there are other closer providers in much closer geographic proximity to that individual who would be engaging in telehealth with them. That said, it does anticipate that there would be, catchment areas, appropriate catchment areas for providers and the people they are treating via telehealth. For example, this question happened to come in from a provider who I happen to know is in the Albany area, the Capital District. And certainly they have rural areas up in the North Country that they service. And the notion would be that they could treat those patients via telehealth because if needed, those patients could travel down to the Albany area to be seen in person. So that's where the so-called reasonable distance requirement comes into play. Otherwise, as was pointed out in the presentation, whether or not a person is seen in person or via telehealth is driven largely by provider types. Okay, so MDs, DOs, nurse practitioners, PAs, etc. Those who are generally engaging in medical modalities, not behavioral health. It's driven by the stage of the illness, right? The acute, subacute, or non-acute stage of the illness, whether or not the person has been deemed to have reached MMI, and then the type of visit, right? If it's a procedural visit, clearly that would have to be done in person. If it's a routine follow-up on a well-established patient just to discuss laboratory results or something like that, then that would be more conducive to telehealth. For behavioral health providers, it's a slightly different set of parameters. There's not the same stage of illness, et cetera, and procedural type considerations. Rather, it depends more on whether or not the person has the ability and inclination to participate in telehealth, whether or not all of the same behavioral health services can be provided with the same efficiency, et cetera, via telehealth as they could via in-person, and whether or not there's any other compelling reasons that the in-person visit should be performed. And there is the requirement for the behavioral health specialists to document that with each telehealth visit. So that is the very perhaps long-winded answer to the reasonable distance question, but the reasonable distance should not be confused with the sort of ongoing requirements for in-person visits. With that, I will pass the mic to Paula Rausch.
Hello, this is Paula. I'm a nurse in the medical director's office. We have a question. How can the provider communicate with level 2 reviewers? Many insurers do not have physicians on site, and they contract with a medical review organization. The level 2 for level 2 reviews, and the level 2 physician reviewers are actually employees of that medical review organization. Therefore, there is not really a direct way to contact them. However, the system, the PAR system in OBLR, does provide the ability for insurance carriers to request further information and initiate contact with providers through the system. So many times if there's missing information, you should just keep an eye on your dashboard. You will get a notification that says they're looking for additional information, and the system will allow you to communicate with the carrier through using that part of the system.
There's another question that states, has the Workers' Comp Board changed the requirements for submitting an HP1? A few carriers have advised that treatment notes are required with the HP1 submission. However, this requirement is new and is not posted on the Workers' Comp Board website. If the process has changed, will notice be sent out to the provider community? So first of all, the biggest thing, right, that changed with HP1 filings is that they became electronic with OnBoard launch last May, as opposed to the paper filings. Secondly, it has always been sort of a standard practice that the provider submitting an HP1 is best served by providing any relevant supporting documentation for that HP1 so that it increases the likelihood of it being determined in their favor. What is relatively new and that folks may have noticed, in addition to the electronic filing, is that for HP1s that are sent for arbitration, providers are, in their notice of arbitration, are receiving very specific instructions with respect to what medical documentation should be submitted in support of that arbitration. And carriers are similarly being advised as to what information they should submit in support of their side of the arbitration. So that is a relatively new item that has been designed to facilitate the arbitration process, to make it faster, and to help zero in both providers and carriers as to what information specific to the question that will be addressed in the arbitration will best help them illustrate their side of the arbitration. In terms of providers being notified about it, so first and foremost, with every notice of arbitration that's being sent out, the providers are receiving a very detailed letter as to what they should provide. And our website has actually recently been updated to include that information as well.
We have a question regarding how to retract a PAR that has mistakes on it. Unfortunately, at this time, the system does not have the ability to retract PARs. Once they've been submitted, you cannot revise them or withdraw them at this point. Generally, what we recommend is if you know that there is a mistake on it, you can certainly reach out to the insurer and maybe let them know what information was missing or what the mistake was. You can also email the medical director's office at the email that's showing up right now, mdo@wcb.ny.gov, and we can provide you some assistance in some cases. There's another question asking how psychologists apply for a variance for psychotherapy. You would have to first make sure you are registered to use, to access the medical portal and use the OnBoard system. From the OnBoard system, you can go in and create prior authorization requests. What we can do is, if you would like a more detailed response on that, please email the email address that's above, and we can certainly send you some direct links to our website that will assist with this process. and we can help fill in some of the gaps. We have a really great overview of the process, how to register. There's provider training that is wonderful. It's got screenshots to walk you through how to navigate the system. But again, we can certainly help fill in some of the gaps if more assistance is needed.
Hi, this is Dr. Tachi again. There's a question in the chat that says, quote, I believe you said IME evaluations for patients may be done virtually if all parties agree. Can you define what parties? And so just to clarify that component of the telehealth presentation, as folks on this call know, there is no treating relationship between an IME provider and a claimant undergoing an IME. So the telehealth regs really are defining the parameters of the treatment relationship between a treating provider and a patient. That said, we did feel it was important to clarify the use of telehealth for IMEs. So when we say parties, typically that refers to the injured worker and the carrier or the self-insured employer. In practice, what that typically also involves is the representative of the injured worker and the representative of the carrier or the self-insured employer. So if both sides to the claim agree that the IME can be done via telehealth, then an IME can be performed via telehealth, with the exceptions, of course, of IMEs that are being done for things like permanency or determining permanent impairment, etc. Those still need to be done via in-person exams.
There's a question that says, can a PT or OT request treatment codes, or this has to be submitted by physicians? It depends on what type of treatment you're requesting. The process has not changed with the implementation of OnBoard in terms of physical therapists and occupational therapists, what they can request or not request. If it's an MTG-related body part, physical therapists and occupational therapists are not permitted to submit PARs, and it would need to be the referring provider. However, physical therapists and occupational therapists do have the ability to submit PARs for non-MTG over 1,000 and under 1,000. And as shared a little bit earlier in the presentation, there's a beautiful little chart that shows exactly what types of, right there, beautiful, who can do what in OnBoard. So this is also found on our main website too. There's an additional question saying, should providers expect calls from the carriers or independent reviewers, or everything should be through OnBoard? Right now, all PAR submissions are through OnBoard. Some carriers you may be experiencing that some carriers are calling, but it's not required. Any initiation of a request for additional information would most likely be coming through the system.
This is Dr. Tachi again. There's a question that states, why are providers not licensed in New York State being permitted to make decisions regarding treatment, et cetera, on New York workers' compensation patients? So the regulations, as is correctly pointed out in the question, state that level 2 reviewers in the OnBoard system must be physicians licensed in the state where they reside. And the expectation, of course, is that they're licensed physicians and they familiarize themselves with the New York State medical treatment guidelines, et cetera. Their determinations are not based on New York State law per se, right? They're making medical necessity determinations based on the medical treatment guidelines. It should be noted that this is not a new requirement as a result of OnBoard or the PAR process. Carriers have had physicians on staff for years, even prior to OnBoard. who may or may not have been, they had to be licensed physicians, but they may or may not have been licensed in New York State.
Thanks, Dr. Tachi. I do see a few questions seem to be pertaining to billing, the CMS 1500 billing and XML submission. Unfortunately, it looks like our subject matter expert on this was not available to attend today. So I just want to highlight, again, the email address and the website. If you have any questions, please feel free to email that cms1500@wcb.ny.gov. Again, just note that there's no dash in the email address, so it's just a straight cms1500@wcb.ny.gov, and hopefully someone can answer your question. And it looks like there are no other questions in the chat box. We are getting close to 1 o'clock, so we're going to go ahead and wrap up. Again, I want to thank you all for joining us today, and thank you to our medical director's office team for being on hand to answer any questions. When you close out of your webinar today, you will be directed to take a brief survey. We greatly appreciate you taking a few minutes to do so, just so we know how you let us know how we are doing on these presentations. I would also like to remind you to sign up for the workers' compensation news, including information on future webinars. You can do so by going to our website at wcb.ny.gov. Scroll down to the bottom of the homepage and select Get WCB Notifications. We do also distribute information via social media, so please be sure to follow the board on Facebook, Twitter, and Instagram. And again, I want to put one more plug in for that YouTube page where you can find dozens upon dozens of previously recorded versions of this webinar, as well as other webinars that are very pertinent to providers. Also, don't forget to visit the provider-specific page on our website, where we regularly share updates on what's new and important for providers to be aware of. Please visit wcb.ny.gov and select the Provider Updates quick link on the provider page.